Being a doctor requires you to do a lot of admin work, which can pile up if you're not being efficient with your time. These include documenting notes in the morning, updating other doctors to their patient status, and ordering tests and medications for the patient on the online system. Sometimes the amount of time that you spend on admin work can actually exceed the time that you spend seeing patients, and especially when you start off as a junior doctor. At the same time, you need to stay organized, as you need to prioritize properly so important things get done first, even when you're tired and even when there are 20 other things to follow up on. Forgetting to do something is seriously not recommended, even simple documentations to other doctors or updating the patient's family. These might seem more like trivial issues, but we have to remember that the patients and their family usually take their healthcare seriously, as well as put a lot of trust in the doctor. And it is only common courtesy for us to show them that we are invested in their care and recovery, as well as show them the professionalism they expect from a doctor. The first day for me was full of uncertainty, as it was for many other people. Due to this COVID situation, I did not have the same amount of time as an intern in hospital as my seniors did in the years prior. So even actions that eventually became second nature, like medicine changes and discharging patients, on the first day are really difficult to do, especially if you are on your own. There is this sense of responsibility to the patient that you rarely feel as a medical student, and you really want to get things right the first time. At the same time, the system you use might be unfamiliar or difficult to navigate, causing you to waste further time. In the end, I relied on my more experienced doctors to guide me through the process, asking many questions along the way. Luckily for me, the department I was placed into had very understanding bosses and encouraging colleagues who made my first day and week very smooth and eased me into my role as a junior doctor. The lesson here is, in order not to make life too difficult for your seniors and colleagues who also have their own things to do, adapt fast and don't be constantly reminded to do things. But at the same time, don't be afraid to clarify, because most seniors will be willing to help you, especially since you're new. The most rewarding thing about being a doctor is seeing the plans made by the entire team come to fruition and make a difference in the patient's life. This doesn't just mean curing the patient, because sometimes cure is simply not possible. But that just means what actions we take to give relief to the patient and to comfort them become even more important. And to do that, we have to treat the patient as a person rather than just a patient with so-and-so disease. We have to understand their agenda and involve them in their own care. We have to address their social, emotional, and other needs. And we need to communicate the plans well and give them hope that something can and will be done. But when the plan goes well, and the patient and the family enjoys their experience with the team, feels comforted by our words and actions, and leaves feeling that their life has changed for the better, I feel satisfied. I believe that the interactions the patient has with the hospital are as important as the quality of healthcare they are given. When both are done well, it is very rewarding to see, and it reaffirms my decision to be a doctor as well. My advice to students is that you should have a reason why you want to do medicine. This might sound a little bit controversial, but your reason doesn't need to be a personal calling to medicine. It doesn't require you or your loved one to have your life changed by an experience with a hospital or doctor, which I believe is not too common of occurrence in the first place. It can even be a selfish reason, like you want to be a great surgeon who can perform complex surgeries efficiently and with good outcome. Or you want to have a well-to-do life on doctor's salary being your local neighborhood GP. These are all valid reasons. It would be ideal if all doctors understood that being a doctor is a privilege, but that is not realistic to expect, and that is fine. It is important to have a reason strong enough, so you always have something to look back to when you experience really bad days, of which there will be many in your career. When you feel totally emotionally and physically drained, you will know why you continue to press on with work and why you continue to be a doctor. Remember that medicine is a career that is lifelong, demands lots of time and energy, forces you into plenty of situations where you have to rise to the occasion and go out of your comfort zone, and requires frequent updating of your own knowledge. Before you say you want such a life, make sure you have a good reason to do so.